Maya had been putting off this doctor's visit for months. At 28, she felt healthy and strong, but the irregular cycles and occasional pain had been getting worse. Her mother kept telling her to see a specialist, and finally, Maya decided. It was time. The medical center looked impressive with its glass walls and modern furniture. Maya sat in the waiting room, flipping through magazines, trying to calm her nerves. She had always been the type of person who worried about everything, but today felt different. Something deep inside told her this visit would change everything. Dr. Jackson called her name from across the room. He was younger than she expected, probably in his early 30s, with kind eyes and a gentle smile. As they walked to his office, he made small talk about the weather and asked how her day was going. Maya appreciated how he tried to make her feel comfortable. The examination room was bright and clean. Dr. Jackson explained each step of the process, making sure Maya understood what was happening. He had been working in women's health for 8 years and had seen thousands of patients, but something about Maya reminded him of his younger sister. Maybe it was her nervous laugh, or the way she asked thoughtful questions about everything. After the initial examination, Dr. Jackson's expression grew serious. He needed to run some tests and take a closer look at what was happening inside. Maya felt her heart start beating faster. The word tests always made her anxious, but Dr. Jackson assured her they would figure out what was going on. 3 days. Later, Maya returned for her results. The waiting felt endless. She had barely slept the night before, imagining all sorts of scenarios. When Dr. Jackson finally called her back to his office, she could tell from his face that the news wasn't good. He sat down across from her and took a deep breath. The tests showed something that would be difficult to hear. Maya had severe damage inside her reproductive system. Years of untreated inflammation had created thick scar tissue throughout her womb. The damage was extensive, covering areas that were crucial for having children. Maya felt the room spinning around her. Since she was a little girl, she had dreamed of being a mother. She used to play with dolls and imagine what her children would look like. She had even picked out names and thought about the bedtime stories she would read to them. Now, sitting in this sterile office, those dreams felt like they were crumbling. Dr. Jackson explained that most doctors would recommend removing her womb completely. It seemed like the safest option, given how damaged everything was. The medical textbooks were clear about cases like this. But as he looked at Maya, watching tears roll down her cheeks, he felt something stirring inside him that went beyond his medical training. Maya asked if there was any other option, any chance at all that she could still have children. Her voice was shaking and she gripped the arms of her chair. Dr. Jackson had seen this reaction many times before, but Maya's pain felt different somehow. It wasn't just sadness. It was the crushing weight of a future that had suddenly disappeared. That's when Dr. Jackson made a decision that would change both their lives forever. He had been researching an experimental treatment for cases like Maya's. It was risky, unproven, and most of his colleagues thought it was too dangerous to try. The success rate was incredibly low, maybe 15% at best. But looking at Maya, seeing her desperate hope mixed with crushing disappointment, he knew he had to offer her this chance. He explained the treatment slowly and carefully. It would require multiple surgeries, each one more complex than the last. Maya would need to take powerful medications that could make her sick. The recovery would be long and painful, and there was no guarantee it would work. In fact, the chances of failure were much higher than success. But Maya didn't hesitate. She looked Dr. Jackson straight in the eyes and said she would try anything. She didn't care about the risks or the pain. This was her only shot at the life she had always wanted, and she was willing to fight for it. Dr. Jackson felt a strange mixture of admiration and concern. He had treated many brave patients over the years, but Maya's determination was something special. She wasn't just agreeing to treatment, she was choosing to believe in a miracle when everything seemed hopeless. As they scheduled the first surgery, Dr. Jackson found himself thinking about Maya long after she left his office. Usually, he could separate his professional life from his personal feelings. But something about this case felt different. Maybe it was because Maya's condition reminded him of his own mother's struggles, or perhaps it was the way Maya faced her diagnosis with such courage. That evening, Dr. Jackson stayed late at the hospital, reading every research paper he could find about experimental treatments for severe reproductive damage. He called colleagues around the world, asking for advice and sharing Maya's case details. He knew he was taking a huge professional risk by attempting this treatment, but he also knew he couldn't live with himself if he didn't try everything possible to help her. Maya went home that night and sat in her empty apartment, thinking about the journey ahead. She was scared, but for the first time in weeks, she also felt hope. Dr. Jackson had given her something precious, a chance. It might be a small chance, but it was enough to hold on to. She called her mother and explained everything that had happened. Through tears, she described the diagnosis and the experimental treatment option. Her mother promised to be there for every appointment, every surgery, and every difficult day ahead. Family support would be crucial for what was coming. The next few weeks flew by as Maya prepared for surgery. She researched everything she could about her condition and the proposed treatment. Dr. Jackson patiently answered all her questions, no matter how many times she asked the same things. He explained each step of the process and made sure she understood both the hopes and the risks involved. As the surgery date approached, Maya felt a strange calm settling over her. She had made her choice, and now all she could do was trust in Dr. Jackson's skills and hope for the best possible outcome. She didn't know it yet, but this was just the beginning of a journey that would heal much more than just her body. The morning of the first surgery arrived faster than Maya had expected. She woke up at 5 in the morning, her stomach filled with butterflies. The hospital had asked her to arrive early, and her mother was already waiting in the kitchen with a cup of tea and a reassuring smile. Dr. Jackson met them in the pre-surgery area. He looked calm and confident, which helped ease Maya's nerves. He explained once more what would happen during the 8-hour procedure. He would carefully remove all the scar tissue that had built up over the years, then work to rebuild the damaged areas piece by piece. It was like restoring an old house, he said. You had to take apart the broken parts before you could build something new. The surgery was even more complex than Dr. Jackson had anticipated. Under the bright operating room lights, he could see just how extensive Maya's damage really was. What should have been healthy tissue was covered in thick, tough scars. But as he worked hour after hour, he felt more determined than ever to give Maya the chance she deserved. When Maya woke up in recovery, everything felt fuzzy and distant. The first face she saw was Dr. Jackson's, and even through her medication-induced haze, she could see cautious optimism in his eyes. The surgery had gone well, he told her. They had removed more scar tissue than expected, which was actually good news. Her body now had a real chance to heal properly. The next few days in the hospital were difficult. Maya felt weak and sore, and sometimes the pain made her wonder if she had made the right choice. But every morning, Dr. Jackson would appear at her bedside with his gentle smile and encouraging words. He would check her incisions, ask about her pain levels, and always find a way to make her laugh, even on the hardest days. What surprised Maya most was how much time Dr. Jackson spent with her. Other doctors would rush in and out during their rounds, but he would sit in the chair next to her bed and actually listen when she talked. She found herself sharing stories about her childhood, her dreams, and her fears about the future. He was such a good listener, and somehow talking to him made everything feel less scary. Dr. Jackson found himself looking forward to these daily visits more than he should. There was something special about Maya's spirit that drew him in. Even when she was in pain, she would ask about his day and thank the nurses for their care. She had this way of finding something positive in every situation, and it reminded him why he had become a doctor in the first place. 3 weeks after the surgery, Maya was finally strong enough to go home. Dr. Jackson gave her detailed instructions about her recovery and scheduled weekly follow-up appointments. As she gathered her things to leave, she felt a strange sadness about not seeing him every day anymore. Over the past few weeks, their conversations had become the highlight of her hospital stay. The weekly appointments became something both Maya and Dr. Jackson looked forward to. They would discuss her healing progress, but their conversations always seemed to drift to other topics. Maya learned that Dr. Jackson had become a doctor because his own mother had struggled with health problems when he was young. He had felt helpless watching her suffer, and medicine gave him a way to help other families avoid that pain. Dr. Jackson discovered that Maya worked as an elementary school teacher and had always dreamed of having a big family. She talked about her students with such love and enthusiasm that he could see what a wonderful mother she would be. Her passion for helping children learn and grow reminded him of his own dedication to healing. 2 months after the first surgery, the test results showed promising signs of healing. Maya's body was responding better than anyone had dared to hope. The inflammation was decreasing, and new healthy tissue was starting to grow where the scars had been removed. Dr. Jackson was cautiously excited, but he knew they still had a long way to go. The second surgery was scheduled for 3 months after the first. This time, Dr. Jackson would work on rebuilding the delicate structures that had been damaged. It was even more precise work than the first surgery, requiring hours of careful microsurgery. Maya felt more confident this time, trusting completely in Dr. Jackson's skill and dedication. During her recovery from the second surgery, Maya noticed that Dr. Jackson seemed to spend even more time with her than before. He would bring her medical journals to read when she was bored, and once he even brought his lunch to eat in her room while they talked. The nurses started to notice too, but they just smiled knowingly and gave them privacy during his visits. The conversations during this recovery period went deeper than before. Maya shared her fears about whether the treatment would actually work, and Dr. Jackson admitted that this case had become more important to him than any other in his career. He had never felt so personally invested in a patient's outcome, and sometimes that scared him. One afternoon, as Maya was getting ready to go home after her second surgery, she realized something had changed between them. What had started as a doctor-patient relationship had slowly transformed into something that felt like friendship, and maybe even something more. The way Dr. Jackson looked at her, the extra time he spent explaining things, the genuine concern in his voice. It all felt different from how other doctors had treated her. Dr. Jackson was experiencing the same confusing feelings. Every night, he found himself thinking about Maya's progress, not just as a medical case, but as a person he had grown to care about deeply. He knew these feelings were complicated and potentially problematic, but he couldn't deny that Maya had become much more than just another patient to him. As Maya left the hospital that day, both she and Dr. Jackson knew that their relationship was evolving into something neither of them had expected. The healing process was working on more than just her physical condition. It was creating a bond between them that would soon become impossible to ignore. Everything seemed to be going perfectly. Maya's recovery from the second surgery was ahead of schedule, and her latest test results showed better healing than anyone had hoped for. She was back to teaching her third-grade class, and for the first time in months, she felt like her old self again. Dr. Jackson was thrilled with her progress and had even started talking about the possibility of trying for a family within the next year. Then, on a Tuesday morning, 6 months after her first surgery, Maya woke up feeling terrible. She had a high fever and sharp pain that felt different from her usual recovery discomfort. Something was definitely wrong. Her mother rushed her to the emergency room, where the doctors quickly realized Maya had developed a serious infection. The news hit Dr. Jackson like a punch to the stomach. He was in the middle of seeing other patients when the emergency room called him. He dropped everything and ran to Maya's bedside, his heart racing with worry. When he saw her lying there, pale and weak, fighting a fever that wouldn't break, he felt scared in a way he had never experienced as a doctor. The infection was aggressive and dangerous. It had spread through the areas where Dr. Jackson had performed the surgeries, threatening to undo all the healing progress Maya had made. Worse than that, the infection was putting her life at risk. The next 48 hours would be critical. Dr. Jackson made a decision that surprised everyone, including himself. He canceled all his other appointments and stayed at the hospital around the clock. He set up a small cot in his office and checked on Maya every few hours throughout the night. The other doctors and nurses started to whisper among themselves. They had never seen Dr. Jackson act this way with any patient before. Maya drifted in and out of consciousness during those scary 2 days. Sometimes she would wake up and see Dr. Jackson sitting beside her bed, reading medical journals or making phone calls to specialists around the country. Even in her fevered state, she could see the worry in his eyes and the way his hands shook, slightly when he checked her vital signs. On the second night, Maya's condition got worse. Her fever spiked dangerously high, and her blood pressure dropped. Dr. Jackson called in every favor he had, bringing in the best infectious disease specialists in the state. He refused to leave her side, holding her hand and talking to her even when she couldn't respond. That's when Dr. Jackson realized the truth he had been trying to avoid for months. His feelings for Maya had grown far beyond professional concern. Watching her fight for her life, he understood that he had fallen in love with his patient. The thought terrified him, not because he was ashamed of his feelings, but because he knew how complicated this made everything. The hospital's ethics committee noticed Dr. Jackson's unusual behavior and called him in for a meeting. They were concerned about his level of involvement in Maya's case. The head of the committee, Dr. Peterson, was a kind but serious woman who had seen situations like this before. She explained that Dr. Jackson's emotional attachment might be affecting his medical judgment. Dr. Jackson knew they were right, but he couldn't bring himself to step away from Maya's care, especially not while she was fighting this infection. He made a compromise with the committee. He would bring in another doctor to officially take over Maya's case, but he would continue as a consulting physician. It was the only way he could stay involved in her treatment while following the hospital's ethical guidelines. The new doctor, Dr. Williams, was experienced and capable, but Maya could immediately tell something had changed. When she was finally well enough to understand what was happening, she felt confused and a little hurt. Why had Dr. Jackson stepped back just when she needed him most? She didn't understand the complex ethical rules that govern doctor-patient relationships. The infection finally began to respond to treatment after a week of intensive care. Maya's fever broke, and slowly, her strength started returning. But the emotional healing would take longer. She felt abandoned by the one person who had given her hope when everything seemed impossible. Dr. Jackson continued to check on Maya, but now their interactions felt awkward and formal. The easy conversations they used to have were replaced by clinical discussions about her treatment plan. Maya could see the sadness in his eyes, but she didn't understand why everything had changed so suddenly. One evening, when Maya was finally strong enough to walk around the hospital corridors, she found Dr. Jackson sitting alone in the family waiting area. He looked exhausted and worried. Without thinking, she sat down beside him and asked if he was okay. For the first time in days, he looked at her with the same warmth she remembered from before. Dr. Jackson took a deep breath and decided to be honest with her. He explained about the ethics committee and why he had to step back from her official care. But more importantly, he admitted that his feelings for her had grown beyond what was appropriate for a doctor-patient relationship. He had fallen in love with her, and that love had made him lose his professional objectivity. Maya felt her heart racing as she listened to his confession. She had sensed something special between them for months, but she had never imagined he felt the same way. The relief and joy she felt were almost overwhelming, but they were mixed with confusion about what this meant for her treatment and their future. They sat in that quiet waiting area for hours, talking about their feelings and the impossible situation they found themselves in. Both of them knew that their relationship had crossed a line that couldn't be uncrossed. Maya's medical care would continue with Dr. Williams, but their personal connection had become something neither of them could ignore anymore. The infection had been a wake-up call for both of them. Maya realized how much Dr. Jackson meant to her, not just as her doctor, but as the man who had given her hope and had stood by her through the most difficult time of her life. Dr. Jackson understood that his feelings for Maya were real and deep, and that he would have to find a way to balance his professional responsibilities with his personal emotions. As Maya's strength returned over the following days, both she and Dr. Jackson knew that their relationship would never be the same. The crisis had forced them to confront feelings they had been developing for months, and now they had to figure out how to move forward in a way that honored both Maya's medical needs and their growing love for each other. The weeks following their honest conversation in the hospital waiting area were the most difficult of Dr. Jackson's medical career. Every morning, he woke up thinking about Maya and wondering how she was doing. He could no longer be her primary doctor, but he couldn't stop caring about her recovery or her well-being. Dr. Williams, Maya's new doctor, was professional and skilled, but Maya missed the personal connection she had shared with Dr. Jackson. During her appointments, she found herself asking Dr. Williams to pass messages to Dr. Jackson or wondering what he would think about her latest test results. The new doctor was kind but distant, treating her condition like a textbook case rather than understanding her personal journey. Dr. Jackson faced sleepless nights wrestling with his conscience. He had spent his entire career maintaining professional boundaries, and now he found himself in uncharted territory. He consulted with his mentor, Dr. Rodriguez, an older physician who had guided him through medical school and his early career. Dr. Rodriguez listened patiently as Dr. Jackson explained the situation. The older doctor smiled knowingly and shared his own story from 30 years earlier, when he had fallen in love with a patient who later became his wife. He explained that while the medical profession had strict guidelines for good reasons, sometimes life presented situations that couldn't be solved by following rules alone. The key was to handle everything with complete honesty and integrity. After much soul-searching and several consultations with medical ethicists, Dr. Jackson made a decision that would change both their lives. He would officially remain uninvolved in Maya's medical care, allowing Dr. Williams to handle all her treatments and follow-up appointments. But outside the hospital, away from the professional environment where they had met, he would pursue a personal relationship with Maya. This decision wasn't easy for anyone involved. The hospital administration was concerned about potential legal issues, and some of Dr. Jackson's colleagues questioned his judgment. But the ethics committee ultimately agreed that as long as he maintained complete separation between his personal relationship with Maya and any medical decisions about her care, he could proceed. Maya felt a mixture of relief and nervousness when Dr. Jackson explained his decision to her. She had been hoping for this outcome, but she also understood the risks he was taking for her. His reputation, his career, and his standing in the medical community were all potentially at stake. The fact that he was willing to take these risks showed her just how deep his feelings really were. Their first official date felt strange and wonderful at the same time. They met at a small coffee shop across town, far from the hospital where they had spent so many hours together. Without the clinical setting and medical discussions, they discovered new things about each other. Dr. Jackson learned that Maya loved old movies and spent her weekends hiking in the nearby mountains. Maya discovered that Dr. Jackson played guitar and had once considered becoming a music teacher before choosing medicine. The transition from doctor-patient to dating couple wasn't always smooth. Sometimes, when Maya had questions about her recovery or concerns about her health, she had to resist the urge to ask Dr. Jackson for his opinion. He had to constantly remind himself not to give medical advice, even when he could see she was worried about something. Dr. Williams proved to be an excellent doctor, and Maya's recovery continued to progress well under his care. The experimental treatment was working better than anyone had hoped. 9 months after her first surgery, her latest scans showed remarkable improvement. The scar tissue was almost completely gone, and healthy tissue was growing in its place. Maya and Dr. Jackson's relationship blossomed during this time. They took long walks in the park, went to movies, and spent hours talking about everything except her medical condition. They were building a foundation for their relationship that had nothing to do with illness or healing. Maya got to see Dr. Jackson as just a regular person, not as the doctor who had saved her dreams of motherhood. Dr. Jackson discovered that Maya was even more amazing outside the hospital than he had imagined. She was funny, intelligent, and had a way of finding joy in simple things. She told him stories about her students that made him laugh until his sides hurt, and she listened with genuine interest when he talked about his research or his hopes for advancing women's health care, but the most meaningful moments came when they talked about their future together. Maya shared her dreams of having children and how grateful she was that Dr. Jackson had given her this chance. Dr. Jackson talked about his desire to continue helping couples facing fertility challenges, inspired by Maya's courage and determination. 1. Evening, as they sat on a bench overlooking the city, Maya asked Dr. Jackson if he ever regretted taking such a big risk for their relationship. He took her hand and told her that loving her was the easiest decision he had ever made. The hard part hadn't been falling in love with her. It had been figuring out how to do it in a way that honored both his professional responsibilities and his personal feelings. Maya's recovery reached a major milestone when Dr. Williams declared her treatment officially successful. 2 years after that first devastating diagnosis, her reproductive system was healthy and functional. The experimental treatment had worked beyond everyone's wildest expectations, and Maya's case would be studied and written about in medical journals for years to come. But for Maya and Dr. Jackson, the real success wasn't medical. It was personal. They had navigated the complex ethical and emotional challenges of their unusual beginning, and their love had only grown stronger through the process. They had proven that sometimes the most unexpected circumstances can lead to the most beautiful outcomes. As Maya left Dr. Williams's office with a clean bill of health, she found Dr. Jackson waiting for her in the hospital lobby with a bouquet of flowers. He had been there for the beginning of her healing journey, and even though he couldn't be her doctor anymore, he wanted to be there to celebrate this important milestone. Looking at him standing there with that familiar, gentle smile, Maya knew that the best part of her story was just beginning. 2.5 years had passed since Maya first walked into Dr. Jackson's office with fear and uncertainty. Now, standing in front of her bathroom mirror on a sunny Tuesday morning, she stared at the positive pregnancy test in her hands, with tears of joy streaming down her face. After everything they had been through, this moment felt like a miracle. She called Dr. Jackson immediately, her voice shaking with excitement. He was in the middle of his morning rounds at the hospital, but when he heard the news, he couldn't contain his joy. His colleagues looked at him strangely as he whooped with happiness right there in the hospital corridor. This wasn't just any pregnancy announcement. This was proof that the experimental treatment had worked completely, giving Maya the natural pregnancy she had always dreamed of. The pregnancy progressed beautifully, with Maya glowing with health and happiness. Dr. Jackson attended every appointment with her, not as her doctor, but as the loving partner who had been with her through the entire journey. Watching the ultrasound images of their growing baby, both of them remembered those dark early days when pregnancy seemed impossible. Maya's story had become legendary at the hospital. Medical students and residents would ask Dr. Jackson about the case during their rounds, eager to learn about the innovative treatment that had saved Maya's fertility. He always spoke about it with professional pride, but those who knew him well could see the personal joy in his eyes when he talked about Maya's successful recovery. The medical community took notice of Maya's case. Dr. Jackson was invited to speak at conferences around the country, sharing the details of the experimental treatment that had worked so remarkably well. The protocol he had developed for Maya became a new standard of care for similar cases, giving hope to countless other women facing the same devastating diagnosis. But for Dr. Jackson, the real reward wasn't professional recognition. It was seeing Maya's happiness every day. She had returned to her teaching job with renewed energy and purpose. Her students loved hearing about the baby that was coming, and Maya found herself sharing her story of hope and perseverance with other women who were struggling with their own health challenges. 8 months into the pregnancy, Dr. Jackson made a decision that surprised Maya. He had been carrying around an engagement ring for weeks, waiting for the perfect moment. One evening, as they sat in the same hospital garden where Maya had taken so many walks during her recovery, he got down on one knee and asked her to marry him. Maya said yes before he could even finish asking the question. As he slipped the ring onto her finger, she thought about how far they had both come. This garden had witnessed her darkest moments and her greatest hopes, and now it was the place where their future together officially began. They planned a small, intimate wedding for after the baby was born. Maya wanted to be able to dance at her own wedding, she said with a laugh, and she didn't want to worry about finding a dress that would fit her growing belly. Dr. Jackson didn't care when or where they got married. He just wanted to spend the rest of his life with the woman who had taught him that love could bloom in the most unexpected places. Their daughter was born on a beautiful spring morning, healthy and perfect in every way. As Dr. Jackson held his newborn child for the first time, he marveled at the journey that had brought them to this moment. 3 years earlier, he had been a dedicated but emotionally distant doctor who lived only for his work. Now he was a father, soon to be a husband, and the happiest man he could imagine being. Maya recovered from childbirth quickly and easily. Her body was now completely healthy and strong. Holding their daughter, she whispered, "Thank you to Dr. Jackson for never giving up on her dreams, even when the odds seemed impossible. He reminded her that her own courage and determination had made the miracle possible. He had provided the medical expertise, but she had provided the hope and strength that made everything work. 3 months after their daughter was born, Maya and Dr. Jackson had their wedding in the same hospital garden where he had proposed. It was a small ceremony with just close family and friends, including Dr. Williams, who had taken over Maya's care, and many of the nurses who had cared for Maya during her long recovery. Maya's wedding dress was simple and elegant, and she carried a bouquet of the same flowers Dr. Jackson had brought her on the day her treatment was declared successful. As they exchanged vows, both of them thought about the unlikely path that had brought them together. Most couples met at work or through friends, but they had found each other in an examining room during the scariest time of Maya's life. In his vows, Dr. Jackson promised to love Maya not just as his wife, but as the woman who had taught him that. Healing was about more than medical procedures and medications. She had shown him that sometimes the most powerful medicine was hope, combined with someone who refuses to give up on you. Maya's vows brought tears to everyone's eyes. She thanked Dr. Jackson for seeing possibilities when everyone else saw only problems. She promised to love him not just as her husband, but as the man who had saved her dreams and then chosen to share them with her. The wedding reception was held in the hospital cafeteria, which had been decorated with flowers and twinkling lights. As Maya and Dr. Jackson had their first dance as husband and wife, their baby daughter slept peacefully in her grandmother's arms nearby. The scene was perfect in its simplicity and joy. Today, 5 years later, Maya and Dr. Jackson have 2 children and are active advocates for couples facing fertility challenges. Maya speaks at support groups, sharing her story of hope and encouraging other women never to give up on their dreams. Dr. Jackson continues his groundbreaking research, developing new treatments for reproductive health issues. Their story has been featured in medical journals and magazines, inspiring both doctors and patients around the world. But for Maya and Dr. Jackson, the most important part of their story isn't the medical breakthrough or the professional recognition. It's the family they built together, and the love that grew from the most unexpected beginning. Every year on the anniversary of Maya's first appointment, they return to that hospital garden with their children. They tell their kids the story of how Mommy was sick and Daddy helped her get better, and how they fell in love while learning to hope together. It's a story of healing that went far beyond medicine, proving that sometimes the most broken things can become the most beautiful when touched by love, determination, and a little bit of miracle.